The government will divert Cebu-bound international flights to Manila starting tomorrow until June 5. Malacanang explains that the local government unit is now running out of quarantine hotels. Let's talk more about this with Health Department Region 7 spokesperson Dr. Mary Jean Loreche. Good afternoon, Doc. First off, what do you think will be the impact of this move by the government to the COVID-19 situation, not just in the country, but particularly in Cebu?
Yes.
All
So
right,
this
there you go.
came as a surprise to us. Remember that we have been in planning and in collaboration with the various agencies regarding our protocols. And so when we received the memo yesterday that our flights will be diverted to Manila, the big question there was why, all right? It primarily, I think, emanated from the fact that we were conducting a test upon arrival. Instead of the day 7, which was actually as mandated by the IATF. So definitely it will have an impact on our economy. Remember that we also need to revive our arrivals or the use of our airport here.
So I guess, Doc, this stems really from what really is a policy here. Are LGUs allowed to somehow have their own interpretation of IATF policies? Because I think this is where Governor Gwen Garcia is coming from.
It's not really about the interpretation of the policy, but rather it is more of based on our history here in Central Visayas, particularly with One Cebu. We have actually been conducting the test upon arrival. You know, there has been, if you look at the timeline of the various IATF resolutions in testing our arriving OFWs, when we had this variants of concern starting on December, there were changes in the days of arrival testing. Meaning to say, initially on December, they wanted it to be upon arrival. And then sometime in January, another resolution came up with a testing on day 5. But here in Central Visayas, we have consistently been doing 2 tests upon arrival and on day 5. Now, sometime in March, because again, our case control of cases is very good, we had an interagency meeting with all the stakeholders, including our overseas welfare, our Department of Tourism, our hotels, including even, and of course us in the Department of Health and the Bureau of Quarantine. So we discussed what could be done, how we would be able to address issues on number 1, making sure that the OFWs, when they arrive, we can release them as early as we can, understanding the need for them to be home with their families without sacrificing their health and of course our cases. So secondly, what we have also seen and heard would be our hotels, if you are going to do really follow the 10-day quarantine or 14-day quarantine, then there will be a lack of hotel rooms because we only have so much. We have, I think, 2,500 hotel rooms that are allocated for our OFWs and our ROFs. Now, you can just imagine if you have 700 to 800 arrivals, then you retain them, that's per day, and then you retain them in the hotel for 10 to 14 days. Then in a matter of 3 days, you would have filled up the hotel rooms already. So we had to address that correspondingly with our meetings. And so we came up with an agreement, and which was actually embodied in the EO of the governor with the guidance also of the Department of Health Region 7, because our understanding also is this, from the basic science of it, when you do the testing upon arrival, and if the arriving passenger truly have the virus in their system in the incubation period, you would still be able to catch it if that is what you really want. Okay? Now, if you really want also to detect if the virus is taken during their transit or maybe during their quarantine period, then you can do the testing on day 7. So if you look in the EO of the governor, it is stated there that for all Cebu arriving passengers, we are going to conduct upon arrival. And then when they are negative on the 3rd day, we release them to the LGU because we are confident that our BHERTs or our barangay health emergency response teams and the barangay health workers would be able to catch them on day 7 for the retesting or reswapping. But then that would open up rooms already in the hotels. And also for those other arriving passengers, we have to still do the day 7 swabbing for us to comply with the IATF resolution. There was just some kind of a variation without really compromising, the capacity to be able to detect the virus should it be truly there. Now, let me just share with you our data. What we did was for day 1 and then conducted also day 7 in compliance with the IATF Resolution 114. And we found out that for 4,167 arriving passengers in a matter of several days, the difference in terms of finding COVID for these two upon arrival and on day 7 is almost similar for different individuals. Meaning to say, there is really not so much a huge significance that you would say that you need to conduct the testing on day 7 only because that is when you're going to catch COVID. So it doesn't work really like that. So we're trying to address all aspects in a holistic manner, making
Doc,
sure that the OFW who is actually excited to be home, we want to be sure also that their mental health, their emotional support is also given.